Hi there, I'm Nurse Mo, and I am so glad that you are here. You're obviously here because you want to thrive in nursing school, and that is what I am all about. So, today I am going to share groundbreaking news with you, you guys. So, guess what? You're not too old for nursing school. Okay, so I know a lot of students return or go back to school, or maybe they put their school plans on hold to have a family and then go to nursing school and then think, oh my gosh, I'm too old for this. Well, I'm here to tell you, you 100% are not. I don't care if you're in your 30s, 40s, 50s, or 60s. You're not too old for this. And we're going to talk about that here today. Before we do that, I do want to let you know that there is a link below this video to a checklist for the new nursing student. So if you really want to start your program feeling prepared and confident and a little bit less lost and unsure of things, check out that checklist. It's going to help get you into that place where you feel like you are ready for whatever nursing school is throwing your way. Okay, so that link is below this video. Now, recently, I conducted a poll. I have a podcast, Ready Nursing, and with that, I have a Facebook group of a lot of nursing students, and I did a poll with them, and I got over 500 responses. And the poll was asking about if you are an older student, so not that traditional student that goes straight from, high school to college to a nursing program, but a little bit of an older student in your 30s, 40s, or 50s, I want to hear about your experience with nursing school. And it was absolutely eye-opening and so exciting. So what I learned from all of these people who generously shared their input was that about 63%, so well over half of the students, felt like being an older student was actually an advantage. Now, I know that a lot of times students think it's going to be a disadvantage and they don't even stop to consider all the possible advantages. So I want you to know other people, just like you, who have gone through nursing school have said being a little bit older was actually an advantage for them. About 22% felt it was just kind of neutral. So to me, that's kind of a win, right? It's not a disadvantage. And only about 15% actually felt they had a disadvantage. So let's talk about what the disadvantages were, and then we'll talk about the many, many advantages. And I want you to try to identify where you might line up with these things. And I think what you'll see is that, yeah, there might be some things that are going to be a little bit harder, but all the advantages far, far outweigh that. So probably the biggest one, and we have to be just very, honest about nursing school schedule is really intense. It's very busy. So juggling family and home responsibilities along with nursing school was one of the bigger key factors in what the older student stated as a disadvantage. Obviously, if you've got a student who's in their, 40s and they've got two small kids at home, that's one thing, right? Versus the student who is in their 40s and doesn't have small kids at home, right? So anytime you have small ones at home, kids, maybe older parents you're caring for, complicated home life, that's going to add to it. So for the students who responded, that was probably the one across the board. Now, to that, I would say you're 100% not alone. Many, many nursing students go through school as parents, as caregivers to other people, as people with part-time jobs, some with full-time jobs, which that's a little bit more difficult, but they make it work. So if you're worried about that for yourself, I just want you to know you're not going into completely uncharted territory. People have done it and they've thrived with it, okay? The other one that was brought up as a disadvantage is there being a bit of a gap or a delay maybe in learning, just kind of getting back into that school mode and learning how to be a student, how to learn after being away from school for a while. So that was considered a disadvantage. Also, learning how to utilize new tech was considered a disadvantage for some. The fast pace was mentioned, but I'm going to tell you right now, it's fast paced for everyone. So I think we're going to just call that one a wash. And then another one that people mentioned was feeling maybe left out because they're not, in the same age group as many of their classmates and feeling left out socially from that. So Yes, all of those things are really important. Juggling childcare, juggling aging parents, juggling home life and school, that is a lot right there. But other people have done it and you absolutely can too. And we'll talk a little bit about this again at the end. And then learning how to learn after being away from school for a while. There's some things that you can do to kind of get back into that groove. And if you've gone through your prereqs, you're already really primed, right? The pump is already really primed for learning again. And then utilizing different tech. Absolutely, you are going to have to be utilizing technology, but it doesn't have to be scary, right? And then what I would say to feeling left out from your classmates is some cohorts are just going to have a skewed age range and be a lot younger. My cohort, I was definitely an older student and I did not feel left out at all. We had many students across all age ranges and we all worked very well together. If you're feeling left out because you feel like you're so much older than the other students, I'm going to tell you something right now. Maybe that's not so much of a bad thing because I know everybody wants to have like the fun college experience. Maybe not everyone, but you think about it, right? I'm going to college. It's going to be so fun. I'm going to make all these friends in nursing school. I guarantee you probably will make some friends, but maybe not 10. Maybe one or two really close friends who you count on. You count on each other throughout the program. That is great. The bigger your social bubble in nursing school, honestly, the higher risk that you're going to waste time and end up socializing instead of studying. Even if you're in a study groups can very quickly, very easily become gripe sessions, venting sessions, social hour, and not actually get anything done. So that's not necessarily the worst thing that could happen. Okay, but let's talk about the advantages. And there are so many advantages to being an older student. You like how I put it in air quotes, right? An older student. Okay, so the very first one, overall, like across the board, out of the people that I had that responded to the survey, maturity and professionalism. Now, this was mentioned over and over and over again. And the reason for this is because nursing school is not it's not for the faint at heart. Okay, I'm just going to be really honest with you. The subject matter is intense. The intention of nursing school is very serious. You are responsible for people's lives. And, it's not always going to be fun. It's not always going to be super interesting, the things that you learn, but they're necessary. And having that maturity and that professionalism to get through school, understanding the gravity of what you were learning and what it actually means is really, really huge. So maturity and professionalism absolutely will be to your advantage, okay? And then the other one is skills from a prior job or career. And it does not have to be a career in healthcare at all. So think about the different jobs you've had. Maybe you had a career in something else where you worked in the same kind of role for a long time and you got very skilled at that. There's a lot of crossover skills that you can take into nursing school and into nursing. So just some, okay, and there's so many more than this, but the ones that come to top of mind are any kind of job or profession where you have to juggle multiple priorities and determine what demands your attention now. That is huge. Not only will that help you figure out like your study schedule and how to do your assignments and when and all of that, but when you're facing a patient situation at the bedside, you've got not just that situation on your plate. There's probably about 10 other things in your orbit, and you have to be able to determine which of these things is the most important and still kind of juggle them all. It's like that guy that spins all the plates. That's basically what you're doing in nursing school and when you're working. So if you've had a job where you've had to juggle multiple priorities, constantly reprioritize things, you're going to be great at figuring out nursing school and the job. Managing or interacting with difficult people is huge because probably not a single day will go by as a nurse where you don't encounter a difficult person. And I'm not just talking about patients or families. I'm talking about coworkers, physicians, people from other interdisciplinary teams, the nurse that gives you a report. It could come from anywhere. So managing or interacting with difficult people, if you've done that in the past, you are so far ahead. That's going to be an advantage for you. Any kind of assessment that you've had to do, and it doesn't have to be assessment on people. It can be assessment of a computer virus. Anytime you've had to go in and figure out what is wrong and where is it wrong, that's a skill that you will use. Research ability. If you've ever had to compile data, compile research, gather information, put it together, and send it back out in a cohesive manner, you're going to do great at looking for things online, discovering new information, writing papers. You'd be surprised at how many students don't know how to do a Google search and will instead hop into a Facebook group to ask a question about a concept and then rely on random people to teach them when they're and I see this happen, about half of the responses will be actually correct and the other half will be way off base, when you could just go and do research yourself. So if you've had to learn how to do that, learn how to determine what is a reputable website, what data can I count as reliable, that is absolutely huge. It will save you so much time, and the information that you get will obviously be of much higher caliber. I'm not saying don't go into Facebook groups and seek support, but it's not the kind of place where you go and ask to be taught a concept, right? And then autonomy. If you've had any kind of a job where you have had to have autonomy, take ownership of a project, of a situation, of a process, of a task, then you're going to have a lot of good skills that translate to nursing school success and bedside success, okay? And then another key area are communication skills. Older students just have better communication skills overall, just from more and more years of practicing, right? And a lot of that communication done in the professional setting or in some kind of a job. So a lot of communication is listening to seek understanding, and then speaking to convey understanding. And when you've had to do that in a past career or just throughout your life, because you've been around longer, you've done this more, that's going to come in really handy when you're in nursing school. Another huge factor that was listed as an advantage, which was earlier a disadvantage, having all that family to deal with. Some people felt that was a huge advantage because they had a built-in support system. They had cheerleaders, someone to talk to, someone to decompress with, who's not in nursing school with you, right? Just someone to listen, someone to distract you with joy, a significant other, kids, parent, whatever it is. A lot of people felt like that was a huge, huge advantage. Another really good one is life experience. And with that comes confidence. Confidence will take you very, very far as long as it's backed up by knowledge. But yes, confidence is absolutely key. It also helps reduce anxiety, and anxiety can definitely interfere with your ability to perform at your max capabilities. Another one is not being afraid to speak up. Like, it kind of goes with that confidence, right? Not being intimidated by professors. A lot of times, if you're an older student, your professors are your age, maybe younger than you, or not that much older than you. It's a lot easier to view that as a colleague than this scary person that intimidates you, right? So a lot less likely to be intimidated by instructors or by nurses that you're working with in clinical, or by the physicians that you have to work with, or other members of the interdisciplinary team. A lot of times students who are older that have that confidence, that have that ability to speak up, because maybe you've had to do it. Maybe you had a job where you had to speak up all the time. These are the students who are more likely to ask clarifying questions in class and speak up for other member, speak up for the cohort if that comes up. So absolutely a huge advantage. Another one is just being more motivated, because maybe the stakes are higher for you. As an older student, you're coming back into this game of going to school, getting your degree. Maybe you've got a family, you've got kids, right? A spouse or kids, or a spouse and kids. that are 100% relying on you getting through this program and going out there and getting a really great job. So that is highly motivating. It definitely makes the stakes a lot higher, but sometimes that's a really good motivator for people. A lot of times, older students state that they required less hand holding as they went throughout their programs. And with that, we have that autonomy. If you have that autonomy in another career, another kind of a job that you may have had, you may not need as much hand holding as you go throughout your program. You will take ownership of your education. This is a huge advantage because no one's going to spoon feed you in nursing school at all. There's no time for that. There's 100% not time for that. They're going to tell you what you need to know. They're going to give you the information, and they're going to expect you to take ownership of that. So being able to do that, huge advantage. That can be a huge culture shock for a lot of students. So that would be a big one. And then another one is problem solving ability. That is huge. Being able to solve problems, being accountable to yourself, and being very resourceful. These are all things that you've probably done just in life experience, just as you've gone through other jobs or your career. You've developed these skills, and they are essential. If I had to pick one kind of trait that makes a nursing student successful, it's not smarts, it's not motivation, it's not dedication, it's resourcefulness. 100% it's resourcefulness. So if that is you, if that sounds like you, if you know that you've relied on your ability to be resourceful in the past, you're going to do really, really well in nursing school. So again, if you're heading into nursing school as that non-traditional older student, again, I just want you to know you're not alone in this. You're not going to be at any major disadvantage, okay? But if you do feel like you might have a little bit of those disadvantages that we talked about earlier, yes, I believe the advantages far outweigh them, but let's address them a little bit. So some things you can do ahead of time if you feel a little nervous about technology, which I realize most people have at least some basic computer skills, but maybe you're just like not into that kind of thing and you haven't needed to really get super savvy with all of this stuff. Well, enhance those skills ahead of time, because I can guarantee one thing about nursing school is there's not going to be time for remediation, meaning there's not going to be time during nursing school to learn things that they expect you to already know. So, and one of those things they expect you already to know is like general computer literacy. So take a little time ahead of time for that. And some things that you could do to enhance your computer literacy ahead of time are just learn how to do the basics. This would be get a Google Drive set up, learn how to make a Google Doc, make a Google presentation, share a Google Doc, because that's a great way to collaborate with your classmates on group projects. Learn how to upload documents, learn how to download documents and things like that. And more importantly, when you download them, know where they go on your computer. You'd be surprised to learn how many people download things and then don't know where they go. It's because your computer will put it in a very specific place, and if you don't know where that is, it's really hard to find. Figure that out. Learn how to take a screenshot. Record audio files. Oh, also with the screenshots, your computer probably files them somewhere. You need to learn where those are. They're not just going to be in an obvious place a lot of times. So find out when you take a screenshot how to go get that screenshot, because usually you're going to file it or send it to someone, right? So know how to do that. Get your digital file organization on point so that you can find any document in less than 30 seconds, preferably less than 20, but I'll give you 30 seconds for that. Get familiar with left click versus right click. Lots of computer functionality that you can explore with that. Let me see. Making Quizlets might be another fun thing to learn how to do. Just basically general computer literacy. Your school may have some resources for you on this. So as soon as you can get into the learning management system that your school uses, like Canvas or Blackboard, you want to go in there and see what is available to you. And if there is a tech library or something like that, IT support center, explore and see what the options are. They may have tutorial videos. They may have equipment that you can come check out when you need it. There could be all kinds of things available for you. So make sure that you check that out. And then as far as managing a family, a home life, and school, as much as you can get support systems set up ahead of time, that's going to really, really help you. You got to get your spouse on board. You've got to. If you've got a spouse or if you're sharing custody of children, that other person has to be on board because it is going to affect childcare 100%. Clinical days get moved, you guys, like last minute. Lab days get moved. Things that are mandatory will get sprung on you at the last minute, and it's horribly frustrating. And the school's not doing it on purpose. I promise you, they're not doing it because they don't care about you or they're trying to see you fail. It's just because a lot of times the clinical site has some kind of limitation and they have to scramble. So try to have a little understanding, expect it to happen, and have backup plans for your backup plans. Okay, so getting that support system in place. I have a bonus episode for the podcast that I recorded with a student of mine who just graduated. Her name is Chelsea. She went through nursing school, I think, with 4 kids. So she had some great tips. A lot of students listened to that episode and are really inspired and motivated by her message. So I will link to that, or you can just go to the Straight A Nursing podcast and look for that. It's called, what that episode is called something like Tips for Parents or something like that. But I will also link to that below this video so that you can find it, okay? And then the other thing that I would like for you to do before your school starts is I want you to reassess your learning style. Now, a lot of times students say, I didn't know how to learn. I didn't know how to get back into that. And maybe you're thinking back to the last time you were in a program or even just your prereqs. And maybe that was just last year or a few months ago. Your learning style can change, okay? I always recommend students redo a learning style assessment on the regular because it absolutely can change. But here's the caveat to that. You're not going to be able to use just that one preferred, like let's say you take the quiz and you are so much a visual learner, okay? And you're like, great, I'm going to use that all through nursing school. You can't, because nursing school and nursing relies on you to use all parts of your brain, so all learning styles. Now, you should know which one is your preferred so that you can maximize it wherever you can, but I want you to know you can't just rely on one way, because when you're with a patient at the bedside, you're not going to just get your data in the way that you prefer it, okay? It's going to be coming at you in all kinds of ways. You're going to get visual data from when you look at your patient. You're going to get numerical data like lab values, the blood pressure reading, right? The patient's temperature. All of that's numerical data. You're going to get auditory data. You're going to hear things from the monitors and the devices that you're using. You're going to hear things when you listen to their heart and their lungs, right? You're going to get words like language related data from what someone says to you. Maybe it's a physician conveying the orders that they want you to put in for them because you're talking to them while they're driving home from the hospital, or it's what the patient tells you their experience is. It's going to be data from your hands, what you feel when you touch their hands, assessments with your patient, anything that you read in the charts. You're going to be reading things. So the data is going to be coming at you in a ton of different ways, all at the same time. So you do need to use all those learning styles, but again, reassess what your preferred is so you can use it to your max advantage, but know that you're going to be doing all of this in nursing school, okay? And then just before I close out, you're not alone. There are lots and lots of students who are non-traditional and older students, 30s, 40s, 50s, even 60s. Do not let your age stop you, and don't assume that it will be anything detrimental or disadvantage. I honestly think you're going to have huge, huge advantages with this, okay? So again, below this video, I want you to grab that checklist. If you go through that checklist, you're going to be so much more prepared, feel so much more on top of your game, and ready for what nursing school is sending your way. See you there. Bye.